Welcome back. Joining me now is Dr. Denise Sanderson, a surgeon with Florida Coast Medical Center and Palm Beach Health Network. I know that you are a breast surgeon, and I believe breast cancer is the most diagnosed cancer among American women. Is that correct?
Actually, skin cancer is.
But for women?
But
yeah.
For women. But breast cancer certainly
I think it's in the top two.
Is your number two.
So because of that, it's top of mind for a lot of people when we discuss cancers. I know there's a lot of research. What's giving you the most help and the most hope in treating breast cancer now?
I think it's a push in all of medicine to try to tailor care for patients rather than having a one place to shop approach. We're going with, we look at tumors from a molecular basis, and we try to target treatments so that we can maybe not be as aggressive for some women and know how to be aggressive for the ones who require it. So I think that's really what has changed the game.
What actually facilitated that change? Is it equipment? Is it technique? How does that work?
Research looking at molecular subtypes of breast cancer. So we used to treat breast cancer as ductal cancer or lobular cancer and estrogen positive cancer versus not estrogen positive cancer. But now we actually go even further and look at hundreds of different small subtypes within the tumors, proteins, DNA, RNA, and can classify tumors more specifically so that we know which medications are going to work best for women who require it, which ones are not going to be effective. So it's this research push on the molecular level that has changed it.
And how dramatic has the change been as far as prognosis goes for breast cancer when it's discovered?
Well, I think interesting. If you had asked me 5 years ago, how have we succeeded or how have we improved our outcomes, I would have said, we're really actually about the same. When women present early with breast cancer, we treat them and we cure them. It's a curable disease. When they present late, then it's more of a challenge. But I think that now, even in those early stage breast cancers, you still will have some recurrences. We're able to pinpoint which women are at higher risk of recurrence, and we can now treat them with preventative medications that are improving outcomes.
That's a really amazing line to have crossed, and you said in just the last 5 years.
I would say within the last 5 years.
That's incredible. I have done stories about this before. That it does sound like it is quite an advancement. That's amazing.
Absolutely.
And you mentioned the present early, present later. Let's talk about presenting early, detecting early. Has that protocol changed at all for women?
So, a few years ago, there was the proposition that women shouldn't get mammograms until they're 50 and that they should have them every other year. The breast societies never backed that. We always have felt that mammograms should start at age 40 and they should be yearly. We know that they're safe. We've compared data in America to data in Europe where they do them every other year, and we do not have more cancers, radiation-based cancers in our group. We don't have more cancers. So we know that mammograms are safe at the doses that we give them. So we never change those recommendations. One thing that has changed is there's a mandate for radiologists to comment on how dense breast tissue is. So basically what that means is when you take a mammogram, breast tissue can be predominantly fatty, which is very easy to see through on mammography, or it can have more glandular tissue, which presents a challenge for the radiologist because we're looking for abnormalities through obstacles of normal tissue.
So do you need more frequent mammograms to combat that?
Well, what we do need is ultrasound with that. So that has prompted us to order mammography with ultrasound. And that sometimes is a challenge through the insurance companies, but I think we're doing better by including ultrasound with routine mammography for women who do have dense breast tissue, and that has made a big difference.
I want to address genetic testing because it's such a key to a lot of the reporting on breast cancer. Mm-hmm. And I know that it leads to some preventative or prophylactic surgeries.
Right.
Where do we stand on genetic testing now as far as advancement and how effective it can be?
Well, genetics, less than 10% of breast cancers are genetic or familial. But so why do we ask that question all of the time? Well, because women who have a genetic mutation actually can have up to an 85% chance of developing breast cancer in their lifetime. So this is a small group of women, but with a very high chance of developing. So we want to identify those women when we can. So basically what genetic testing does is about, I would say, approximately 21 genes have been identified that protect us from getting breast cancer. So what we do is we check and see, are those in good working order? And if we find that a gene is not, then we can help that patient in prevention. And many women do opt to be more aggressive surgically and have bilateral mastectomies. If the ovaries are at risk, to have their ovaries removed as well. It also gives us information about other tumors that they may be at risk for, colon, pancreatic, so that we can watch more closely. But also, if a woman does have a genetic mutation, they don't have to have those aggressive surgeries. We have protocols in place to do very close interval observation. So women shouldn't be afraid of genetic testing. If they do test positive, it doesn't mean that they absolutely have to go through life-changing surgery right away. It means that we have a discussion. We look at what their risk truly is and try to create a plan for them.
Doctor, would you come back? Because we're just scratching the surface of what's here.
Of course.
And there's so much more to talk about, but it looks like an outstanding outlook for many patients now, and I know there's much more to talk about.
Yeah, well, I'd be happy to.
Dr. Denise Sanderson, thank you so much. Really appreciate it.
All right.
Next, detecting and curing most common cancers in men.